Hello, my name is Brian Reyes. I'm a current P3 student at Duville School of Pharmacy, and the title of my article is The Safety and Efficacy of Galcanezumab in Patients for Whom Previous Migraine Preventative Medication from 2 to 4 categories had failed. A multi-centered, randomized, double-blind, placebo-controlled Phase 3b trial. It was published in The Lancet in October of 2020, and I chose this article because of my interest in using medications for prophylactic reasons. So the objective was to compare galcanezumab and placebo on the overall mean change in the number of monthly migraine headache days from baseline. The primary efficacy measure was any day with a migraine headache that met the ICHD-3 criteria for migraine or probable migraines. This multi-centered, randomized, double-blind, placebo-controlled superiority study administered the galcanezumab monthly, subcutaneously dosed at 120 milligrams a month. Except for the loading dose when patients received 220 milligram injections for a total dose of 240 milligrams. The patients in the placebo group received the same amount of injections just to keep blinding intact. The subjects were both men and women with an average age of 46 who had previously failed 2 to 4 migraine prophylactic categories. These categories include propranolol or metoprolol, topiramate, amitriptyline, and candesartan, among others. The inclusion criteria needed subjects to have a diagnosis of migraine or chronic migraines, history of migraine headaches of at least 1 year prior to screening with onset before the age of 50, history of at least 4 migraine headache days and at least 1 headache-free day per month on average within the past 3 months, and history of documented treatment failure of 2 to 4 migraine preventative medication categories in the past 10 years due to inadequate efficacy, safety, or tolerability. The exclusion criteria didn't allow patients in if they had a lifetime history of cluster headaches or migraine subtypes including hemiplegic, ophthalmic, and migraines with brainstem auras, history of head or neck injuries within 6 months before screening, history of traumatic head injury associated with significant change in the quality or frequency of headaches, or any acute cardiovascular events or serious cardiovascular risks. The length of treatment had patients monitored for 3 months during the trial period. Patients completed the Migraine-Specific Quality of Life Questionnaire, or MSQ, and the Migraine Disability Assessment, or MIDAS, throughout the trial period. MSQ is a 14-item questionnaire that addressed the physical and emotional effects of migraines on functioning over a 4-week period. This was rated on a 6-point scale and then converted to a 0 to 100 scale. While MIDAS quantified the headache-related disability over a 3-month period, severe disability being represented by a score of at least 21, and very severe disability is represented by a score of greater than 40. The study's primary outcome measure was done on an intent-to-treat population with an alpha set at 0.05. The researchers estimated to need 420 patients to be able to provide the study with 96% power. Power was met as there were 462 patients that were randomized in this study. The mean change in monthly migraine headache days, which is classified as ratio data, was analyzed via the mixed model repeated measure, and it was an appropriate test for its respective data. As for the results of the trial, it was seen that after 3 months, galcanezumab had a significant reduction in monthly migraine days with a least square mean of negative 3.1 and a p-value less than 0.01. It was also seen that subtypes of migraines, such as chronic migraines, with a least mean square of negative 3.7, and episodic migraines with a least mean square of negative 2.6, also were found with p-values less than 0.001. The tolerability of galcanezumab was good, as there were an equal amount of adverse reactions in both the treatment group and the placebo group. The majority of reactions reported were either mild or moderate, such as pain, swelling, bruising, constipation, and vertigo, among others, yet the most common adverse event seen was nasopharyngitis. This occurred in 9% of the placebo group and 7% of the treatment group. There were only 4 severe reactions in this trial, and they were evenly split, with 2 being in the treatment group and 2 in the placebo group. The 2 that occurred in the placebo group were Behçet syndrome and a lower limb fracture, while the two severe adverse events that occurred in the treatment group were hemorrhoids and tonsillitis. The authors were able to conclude that the use of galcanezumab had a significant difference in the monthly migraine days when compared to placebo for patients who had failed multiple migraine prophylactic categories. The strengths of this article include its power, as it was set and met, its statistical tests, as they were appropriate, the outcome measures that were clinically accepted, its inclusion and exclusion criteria were both adequate, the randomization created similar groups in a 1-to-1 randomization, the length of study was sufficient to see an effect in patients, the treatment regimen, since it followed all the recommended dosages, the blinding, as it was double-blinded, and the author's conclusions, as they were all supported by a significant p-value. The only limitation in this study was the recruitment methods, and that's just because they weren't mentioned in the article. This is a level 1 article with minor limitations, and I would recommend the use of galcanezumab with a loading dose of 240 milligrams, followed up by monthly maintenance doses of 120 milligrams in migraine prophylaxis for patients who have failed 2 to 4 other categories of migraine prophylaxis. And this is for the following reasons. Efficacy. So the use of galcanezumab was much more effective at decreasing the mean number of migraine days with a p-value less than 0.001. And the decrease was also seen in migraine subtypes such as episodic migraines and chronic migraines specifically, both with p-values less than 0.001. Safety. There were only 4 serious adverse events in this treatment, with an equal amount in each of the placebo and the treatment groups. Also, the most common adverse event seen in this trial was nasopharyngitis, and this was only seen in 7% of the treatment group and 9% of the placebo group. As for cost, the cost of 120 milligrams of galcanezumab, or a dose, is $724.32 according to Lexicomp. 1 year of galcanezumab would cost the patient around $8,691.84. Placebo had no costs. As for special considerations or populations, this study did exclude patients who had failed more than 4 different categories of migraine prophylaxis, so it can't be known if it would work for them or not. And it should also be known that patients in this study were allowed to use acute migraine medication concurrently if they happen to have a migraine during the study. And some of the medications that they were allowed to use were NSAIDs, triptans, ergotamine, dichlorphenazone, and acetaminophen combination, or any combination of those medications listed. I appreciate you taking the time to watch this journal club, and if you have any questions, please email me at reysb22@dyc.edu. Thank you.